Yeboah Agyekum Francis attack no afa different form na nipa be adwen course me be play Mrs. Ahofefo video na wahwe me pato nwa abotre na hwe video no pa for your sake na video no hwe a me ka asem bi o video mu a kire ene ye nua be ma ba ko so o video say fufuo e ma pompo goita na me nkire mo ni nyina na mu hu ba bia attack no afa the video na ye play yes sister video na mo
na wo pressure do so for wedro na sanye we ka ho Agyekum Francis, do you know that most people on blood pressure medication are on diuretic?
Osi Yeboah Agyekum on hwehwe nkrofo apomudi onemu nkrofo sika na ohwehwe eno na kire se okita agenda eno na kire se okita plan bi so obebrega na se enti se wo ha na se wo make the argument say bi o correct bibi and say bi o person draw attention to something enye no correct da.
Ehun se Ghana phobia sorry attack Yeboah Agyekum Francis wo ne content artist o create no ehun the content dey yin say ya disua o dey church obi aboa ye nsoso a amanfo mu practice ne dey ebo mu pan yie na ye sister anase ye maami o ye na donko ata ni sister ono na chese obe attack Yeboah Agyekum Francis obeka asanse obe so TikTok live kan se bebre won church sire bia Yeboah Agyekum Francis ebeye ye ho nano na Yeboah Agyekum Francis so ababo nti ono so abeche ne side of the story no mu e de ache wo kire mo se sabi so obi te Ghana na mo amote abreche mo mfa nhyem tim se de o te Ghana no bi se de sabi nimdia na nyansa bi enhye na adwene mu ma etima mo mfa abreche no enye se sabi mo nko a na mo wo nyansa na nimdia na se mo nko na bi a mo masua de ye hu bibi nti no mo ka bibi esa manfo tie da bi na ensema yenwa be mai Yeboah Agyekum Francis e de asend ye sister ene de o de ato aso ama emedofo de o sika sai ne de me de ne kwan so ano no ayo se nka sister ntimi ko di yamu no ne kwasa ni kwasa sabi ko be so TikTok live e be condemn ya dia Yeboah Agyekum Francis e de eye no wo so ache na adwe de ache enwa ba yemu rom nkotie ni nyina emra
Yeboah Agyekum Francis attack no afa different form na nipa be adwen course me be play Mrs. Ahofefo video na wahwe me pato nwa abotre na hwe video no pa for your sake na video no hwe a me ka asem bi o video mu a kire ene ye nua be ma ba ko so o video say fufuo e ma pompo goita na me nkire mo ni nyina na mu hu ba bia attack no afa the video no na ye play yes sister video na mo
na wo pressure do so for wedro na sanye we ka ho Agyekum Francis, do you know that most people on blood pressure medication are on diuretic? Do you know what diuretic does? Diuretic wastes fluid from your body. It will catch obia ebia who categorizing no one categorizing who generalizing no who say who pressure who emboja broswa for wedro one can say who anti-diuretic. So see, that is the problem, because you don't practice, so you don't know. You do not practice, so you don't know. So a pressure, Brunana, you can go and read about the pathophysiology, but to diagnose and treat, you have to be really. It's crazy. You guys should talk, because Mecca somewhere and you say it.
You know, say there are so many arrhythmias. As a one, you taking potassium and
life no koi. Na sister you be a me penasem pa me because of say me medical research nti obi a way into the medical field bia no I consume their content nti me penasem so person me hu say me penasem a ye sister ba ko US and that Joe ne yere no na donko me penasem pa for ne back to last born Ezra tem bia me hwe mo videos omo ne kakra mo nyina ne baba boy no me ta hwe mo videos nti I found out say sister we ni nua na ye na donko nti ma me be pair sister isu asem na sister isu kwampo pe ma asem pa o pe ma asem pa because recently ko be video ana o se nkofo se ne o slim ebo mi din na Yeboah me nu ma donye kese na ye na me aka me be comment say she looks so beautiful nti mo on fa dro bia mpo enko kan ni padua because ne ho ye me fe I said it nti onye obi a o very far away me ma wa hu we no wa hu say bibi kwampo na my video na sister ni me nya aduanka obetumi adiem me na kwa bisa me consent if I will do a follow-up video to correct some of the things I say kwanka ebeboa na ade ba ko Ghana make kire mo ni say Yeboah assignment na wade aba no uyo obi na oba na obe criticize I mean ka say criticize you be pacho nya abotre na hwe ni yi because what sister yi on one videos you comment sections always say Ghana for attack you because Oma try so many ways to get Yeboah down yɛde afa soro yɛde afa fom yɛde afa asɔfo yɛde afa prophet yɛde afa abosomfo so ɛna be we content creators so recently brother baako a time bia on the comment on bad the obi ka say good on say bad me say munim no obeye me ho story bebre man koso so but the car say nkofo skip breakfast omo person man no pa say me nipa en skip breakfast man me so because obi a skip breakfast bia if the benefit a onya na Yeboah na eka nipa no nya na physically a me nya ho hwe me nya hwe mfrim just to help somebody me pa to no obi da aduro so ti me ka say mo da aduro so ne de breakfast skipping mo nka ho decide ba kon say na odi fufu tunkwa na odi num na dura because what say Yeboah say skipping breakfast it me bottle nya one thing ene what aduane odi na no pa obenu madu no so bebre de aduro ni tin riba nko anopa ai beti nyama no problem ba nei what na aduane di so na odi anom na duro ene ebo o mo nyina nti ho o mo de fa ho so amfa ena na no se me ko ba bi nti me real quick video no a me kire mu remedy ye ma me mu ne papa mu ene enuro no ne ne ma na ye nom no e ya adoso enti me hwehwe mu ni me research I don't just come out to talk we miss the video or make emphasis be say because you don't practice your professors no mo kire ade no most of them don't practice by abandoning knowledge and wisdom forget it ye ni am Ghana for baby wa butira mo practice but practice now no we get in contact do 1%. Doctors are saying omo surgery now omo ya abrofo no kwa no omo ni omo hu bi omo nkwa tipenko to before they perform a serious surgical process they sit like a board meeting no omo discuss the condition no we can A na we can B na we can C na we can D enti omo to adwen a na omo nyina conclude on one e kire wo say ye omo nyina esu ade ba ko na mo obi a wo say de ofa so ti ade ase this is the video we say obi wo ho a or pressure right ena bebre wa akomayare no mo pressure na ebi mu e wo direct so say the be fluid o mo jam no e ba fom osan ko boka say me tramadol me say boys no enye nitrate ne tramadol I don't even remember saying that me na me Ghana ni am aba be video say tramadol kwa hu sin cocaine me boa no those videos e wo ba bia so me amaka sa asem no me dia be ka so obi nkofa tramadol and obi nkofa red and obi nkofa aphrodisiac I'm the one that always speak against and I give local remedies impo to help people so that be omube jai eno me nka wade bia say watermelon containing L-citrulline eno so bua the trick oxide the bia kind of trick oxide ni am say a dilate the corpora na way the tissue na way be man no na mo ja oguro no de bia me ka enti sister I don't know o ma ho kwan so obi na ba ho some the preview so I don't know but the oye no me hu ni say so the achopa e brega na for because we didn't throw baby to me so in the video e be a tramadol asma me kai I never said that o de ma menchero ade na ti ase obi wo blood pressure the episode hu ni say ni ntin no a constrict enti e pese ntin no mu bie na moja ntimi di mu afusa ne yi blood pressure ntin se moja ados wo ni mu ye ntin ni yi enti pressure do na e de mo na e vasodilators e boa e relax blood vessels na aye stiff no ma emu ego kakra nti me video na me ye no ohwe am kan say so obi da duro su a onkoso na onnum na duro no I was so emphatic about that onkoso na onnum na duro no ade a me kire nyina ye simple me se body ofa body betim ye in 9 days man ka say ye in the whole year ye in 9 days fa body betim na fa watermelon ni chi no watermelon ba ku twemu 9 na chi no fa nsuo 1 liter this is the person tell me say obi wo pressure onnum nsuo ana because I say sad na me chene e nsuo na diuretic minimum dey diuretic e nsuo free nipam ntino o sen num nsuo no me say one problem it's because my sister knows the theory although she practice but onim the area no one ti ase when we say obi so pressure mpo no so wanum nsuo say that okasa me say obi num nsuo so obi so anum nsuo no ye severely dehydrated that the sodium koso say the sodium level koso that dey nesi vasopressin eye release hormone now minimal the con antidiuretic hormone eye release that antidiuretic hormone is something vasopressin no e ba dey nesi e ma vessels no air constricted e sama blood pressure na eshuti unti wo kase me kire obi say onum nsuo for something no na wa momo hu say wa num nsuo anka we na eba ya mu nsuo ade ni yi o obi oga na mbu na nimti asa oni hwe o tu e kasa tieti ana so akọ moja na epim nam droben mu ye mpese ebetwi wo no kese ye betuma na ntwi kese a se blood volume no ba foma entwi ni kese ana se blood vessel ebie say ya te say the hose water car se hose no so a entwi nchen kese anase nsuo na eba no se pressure nim kese a entwi nchen kese two things the diuretic na yede manipa no reduce the volume moja no o se moja half ye nsuo nti se man nsuo na e mu bi ba fom a pressure na enam wonum nurse na atwi nchen. That's number 1. And number 2 ya duru no mo de ama na wasea no maka ho a eboa I dilate ama ntini mu abie na moja na san akwa ensan so ntwi nchen two things na eno no kire say obi wo pressure or num nsuo ana. How much of the water am put bit me akwa say unu say obi wo pressure one num nsuo glass of water say kan dey otuminum 8 ade a me kire me ka say 1 liter any regular glass of water be 250 ml 250 ml me ni say 500 ml 4 is 1 liter right 1 liter 4 glass 4 na nipa na also num 8 enye half the sample si su bia say manipa ni nyina fa ako ennom ne goma enti onfa ne se ni nsuo and eye nsuo so na obi life no na Mrs. Abako be Irish kotomire na o say Ghana de say obi aka brofo say yes woni ma de ne ye nne na o say na potassium crampo na what those concoctions no a bit mama obi anya arrhythmias na o te arrhythmias na a bit maboa na nipa na wu instant. I mean bro body anya no ai potassium bi do say na be lichi aba nsuo no body betin crampo mfa say no nyina potassium do say na wo say doctor bi aka kire obi wo akomayare se ma wonum kube nsuo ni potassium wo kube nsuo enti sa ade na ebe lichi free body na hahan ni mu a ebe ba nsuo no mu nti na me stress on ebe boa blood circulation ebe boa realization of the blood vessel no me kale flavonoids organic compounds wo na eno no mpo no nya ne be ma nitric oxide na akosumpo enzyme na o producing nitric oxide na owo blood vessel blood line ni mu no the friend endothelial nitric oxide synthase sa enzyme no na ye be stimulating your activity no na produce more nitric oxide na the production only say adwene guso regulate the amount of nitric oxide na you producing enko dilate nipa no radio blood pressure that the blood vessel na is stiff. How much can you the person ma demonstration no bi hu me ma ho de betima pia pillar ye fie pillar me ntimi pia o because pillar na dey hold it down emu edu esiwe so the amount of nitric oxide na be kwa eye na hia potassium doesn't need free body in my nsuo. From every angle, you guys were on the live and you were wrong, and you also insulting, saying all kinds of things about me. I said, Mama, yes, I really watch your videos. I like you. You're a good person. But last time I be medical staff say that. Huh? Me know be a me mama kwa person more for but you say so say ne mama for cry jimmy to the reward for about you say you three be church because here benefit or the owo no me bra ba kwa na me kan me say already o si fufuo e ko se go etai the o si e wo fufuo ewe goitrogens na e wo fufuo mu no e wo banche me so for banche a toxin bi o banche me fe cyanide na sa cyanide no ye liver no etimi convert cyanide no so the baby less harmful now come a thiocyanate sa thiocyanate no e compete iodine on say goiter compo ade e tade ba pa a lack of iodine and na o hair higher thyroid gland your gland be heart cell butterfly no o produce T hormones be T3 na T4 na eboa metabolism eboa brain develop eboa na be brain e won fasodie nti thyroid won fasodie pa na ade ba ko a wo use di ni juma e de friend the iodine no nti na o hair nchene mbo no nchene salt mbo no ye food system no na ye di de egu we mo no me pese mebo brand bia won sa nchene na na ye di because iodine bi wo na sa thiocyanate na oni iodine be compete emma yentimi fa enough of the iodine once all children say come on but we dey ma common sense in chira we say kuro ma nipa dodo sen dey fufu na nipa dodo sen na wo goita na wo kompo say the omo kan na kra nipa sen na wo kompo na me fa we the science is that fufu bi enu kwa yeri bayire no bayire mu no yeri bayire banche no banche mu no goitrogens na wo kana e wo banche ni mu no elichi bansuo na ya no an fufu no yegu fufu no ho ansuo no nyina ekọ banchene da obetim kwa yibia di hwensi
mirafo na chese ha chichemu ni nyanya kwa kotie aba no na nim bibi after see enua bai chese obe attack Yeboah Agyekum Francis no ai ye tumra ne atresie se ni followers ni nyina a drop ye se ni se die Yeboah Agyekum Francis die ene to bra che se wona no mo follow ye nwa ba no on be hu se ne oye ne nye enti omo adan omani akwa follow Yeboah Agyekum Francis ebusia an se do di kaka sa ade a wo ye no wa wuni ma oba attack no ne die ene sabi na watwen ehu de ba so we can see so ye hu se Yeboah Agyekum Francis ene wa launch new car an ye yate ene ye hu se eye despite ba ko invite no ewo eye despite automobile museum hono ma tese busia enya asem ketwa efe akono de oye a eso Ghana fuani aye hu se ne oye no daachi bi ebeboa ye no enu ti ene nkofo bi so ahwe hu a omo so hwa de ometimi aye de support ana se ombeboa amena hu se de oye no Ghana fo ye ni so na omo so ye ede ama no yenwa baba ko nurse ni wono so ababonten sa asem wi ya oba church na adwen ede afa ho medafo ye mu ramai yenkoti ni nyina ho no evra
onim asem bia sia wa ho se wontimi discern wonni discernment of spirit tinachire din make analysis na hwe nioma mimi gina we me nurse na ebia mabeka asem bi na obi pese ebia o correct ade bi wo mu ana ebia o force asem na meme kan ye no manka no ensi ne kwan so nti o pese o correct ya the approach fine obi wo ha oni emotional intelligence enti no o kana asem bia ene ye wode ne ni hyedan soade a omuade eno so so ho ene ye wode truthfully no o pese o correct bibi anase ebi o pese o twi nipa adwensi bibi so se ebi amenua wo kan asem we na ha no enka wo ya achia ntimi susu mi wo health sector ide mama nso mi fa we se nka ho na asem na o kan emedi mu ye hwe sa niam we se nyina enti Yeboah Agyekum Francis ensem na ekoso a okoka se ebia nkrofo bi enum nsuo bi nkakra ebia wo blood pressure o cheche ni o mebi no ale ni so be fa obeka directors ho asem no obinum directors a ade a ema nipa ne jonso eyi nsuo free nipa ne body mu into hospital crampo no obi ebia nsuo agina ne nan mu water retention ni ade anase ebia kidney patient ni ade no your protocol ye tron se nsuo dodon se no nom ye se no jonso ye wahu ena say na ye man all these things no tro because say na what you beda onyina na say bia bosom ni nyina ye tro sa de because ye pese ehun say senso ebia senso ebia 1 liter ene ye de man na 1 liter ni nyina call ne body ni wadwunso ni nyina so wanyunso ni nyina na so odwunso half de aka na kwa kogina he enti all these things ni ye check it enti this is a conversation and kabetimi are end very well anko bia de na dwen beba nurse se o German de omo de beba America for de omo de beba Ghana for na kwese ye debate na eko but let the approach to the issue no eniamo ho approach enya approach a ye de correct obi and there is nobody abekọ that way so correct na obe taking in good faith na see Yeboah Agyekum Francis crowd o ya ade the way otimi be chire mu ebeka ni potassium ho nsam ni ade nyina no it means onya abotre so what you see o e chire mu kra keka se o crampo no do ene o sister ni ade o keka sansem ni nyina enti no the next approach no eno na sisu poseled no oba se obese guy no oba se obese guy enti ma menka kire wo wani na ho a onim no na me ka kire no there is approach for issues a obe un say ebia this issue we say the nipa na some person kire enu ni ye pese have a conversation bi ye pese ye kire say ebia obi da se dro so a se no besi fa num nsuo obi e wo kidney disease a obi ensuo gina ne body mu ebia ensuo nenom no se na be ko ne ade won enka ya adesua kese but ono no de no ne approach o de baaye no na enye obi ka so ebia nipa timi kasa otimi yemfum so what about the second one Osi Yeboah Agyekum onhwehwe nkrofo apom de onemu nkrofo sika na ohwehwe eno na kire se okita agenda eno na kire se okita plan bi se obebere guy na se enti se wo ha na se wo make the argument say bi o correct bibi ana se bi o person draw attention to something enye no correct da wo honhoma de making wo beti ase uni honhoma you may not understand but me kire se wo de oni honhoma we need the Holy Spirit, we need discernment of spirit. Just make the analysis. A confess to make it the first approach. And second one, the end of it, too. Me also be a comment on the video, and as I say, and yes, be your healthy guy, no, maybe I be no person correct because or no so medical field, and you're not correct. It is not true. And the second time, oh, mama can say, Yeboah Agyekum Francis, oh, here, Crofosika, Nenyoma Pom dinu here. As I can say, po biacho, biaka nasem, wabefaka. Ena nipa no afele so ebi asem no anka ne yie and no request say apologize to him because a kwan be fa so ne kasa ye no enye proper and no timi nya kokudro say ompo bi acho eya na enim some of the effects of these things but later so at here later people will understand. And to me, that be a say, same be how can be a making sure so Jina the right side. I same be a befa behind, especially on this platform, making sure so Jina there be a no cray. Ujina there be a no cray because I said the better marco. Ure befi as time goes on because in Sembeba. But a who's son so nearby you will not understand. Obia some na fa kai. Obia chena semu. What be count the atoso and no see a kwan fast on the kasa no who say entwe ye enti o hear apology from you or the akukudro be ka say on panicho and na say o menase po bi won ho wa hihye bibi won ho o wa adwen bi fa no ho say o be say the oye no enti say onimo na make catch on you people you may not understand when ye constructive conversation bia and enya ade bia e be debate bia and enya ade bia e be che ne medical new bia a kwan fa so bae no enye na agenda no na agenda say obe pull guy ne down lady no na agenda say obe pull Yeboah Agyekum Francis down because obi person correct obi a enye say no ba no first approach second one mo sha say no be kasai we ye de correct obi there be o wa dream bi say o person body guy ne ye no e pansam no de hye nipa dream say ade bi a guy ne kire bia no e dangerous e ye hu e betimi ase nipa brabo no an agenda. I'm telling you. Me didn't quit in patcho. Share video we say. Yeboah Agyekum Francis. I feel that's so well. A bra and your man quite him not dominate Dawson. Ne radi a piano. A town for a Dawson who be brave. Say, who say entacrache a show. And I'm penning for to say, in nipa any as Sunday or share entacrache. A day name on Mount Piebo. And also, me didn't quit in patcho.
And the lactating mothers, ye knew mamma for. Sa akwani nya 4 months a problem kese ba kwa mufisi ni se anajo on na wamambo so matimi adabi na eye challenge because matena ha ya trechro en na so mfaso intimi mpesa obe risk say okay ma wonti ntimi na eba ne sa nature ne de obodi no onimo ebetimi affect o ade a one na emma no one na emma onfa ho se wawo anase onyanwo ye enti ye hwe bibi ebetimi ya fa ho like video na share mo bi se de Yeboah de aba na de lactating mothers pa but the metro ketu abi ni say anopa wo dware oba siesi no edinkuto twitwi ni nyina ye bibia wi sa awia no sa anopa wia no enkura ne timi da papa na maka che say because akura ne system ni nyini wi ni ntino nka odidi about 3 hours time na e come sign de no wadampa nyan na mana biane ni mia na me kire page so enti wasiesi akura na anopa wi no because akura no be that 3 hours in fact we 11 12 1 2 na akra no what ne was yaman no for anom na bibia na esi African homes kesi pa nse obi wo a sa first 4 months no abusuafo ba ensrahe ebe srasra sa nipa kro no enti time no mo ba normally ya no pa enti ne ba ne da na onya kwanye sa anema no na anajo ono ba time no ontimi san na enti wo no ma nye nchi anopa no ne pato fa wo nchi aje ne kwa anwumre oba no da sa 11 na ubiade ni wiade no koto hwa na wo so wa be sisi o obako se onada hwa na enana fa no wo kan wa no kakra na wo so watimi ada na maka kire se edi wa nya kra no onya 5 hours sleeper ebe boawo ana 4 hours a ebe boawo enti se wuntimi nya ni nyina na jo a because akra ni so the circadian rhythm no ni body's biological clock no enseti ade san wiem ye due to the extent say etimi mo munyane daytime na de kakra noise wa environment no omutimi de sa ade ne da na maye sa teach natural say oda oyema wakomebo le pato oyemu ye kuru noise mi na sa akura we da pato what you say to obey environment ni mu a otimi de sa environment ne da kopim say ni biological clock na na circadian rhythm be fix and sa fe watimi ada anajo and sa time na after 4 months 5 months ko na obetimi ada mamuso mo ho atom into manopa nano emwa as obatan anopa no wama akra na da wie no na wo so wada na onyane no 2:30 ho na bia aduane na wona na mu anyumre no timi je nchia wo mba be chiacha no bibia na akra ne chewo anajo sa akra ne bi su krampo na wotimi nya 2 hours pe e de be so 2 na onya na pa no na eja anya hwede wonya wo 4 na nkofa problem amrel e pato ya ti ase some of these things omo wani koso na wo hwe wadi die yi ha onkonya pressure ni diabetes bia after so wawo e pato ya ti ase
diagnosis based on your symptoms. You got symptoms and your ma or failing. A bit near, your signs and your symptoms. Okay, signs you know maybe a it is signs by the say be a unaya edema a sign you can see the unaya what I say. Oh, how can I say me now every me a symptoms because signs there we see it, symptoms we feel it. And there was the signs and symptoms of HIV, signs and symptoms of gonorrhea. Okay, so Bejunsana me bema movie me. It's a symptom because you are feeling it. Yenfa yeni husa obema movie. But do we see say Ujonsono emo I American? Yes, a sign we could see. So this is the distinction between signs and symptoms. Signs are observed, signs can be seen, while symptoms are felt. Intimate me yao, a symptom because you are the one I will feel it. What I say, you are the fact. Many so chimi a symptoms because you are feeling. So oka sana yes you to make us say ABI, okay, it's a sign, but signs are felt as seen. What unaya you read, oha echa emoja eba, we actually see emoja eba. What you say? But because adena to symptoms you are feeling it. So diagnosis is based on patient presentation, and some of patients never can't show any assessment are also healthcare provider no obe gada. Ebi wo no ma odi weni behu, ebi wo wa onfa weni hu obe in lab. The truth is that in your bebre wa signs and symptoms no na SSA. It is sometimes to be sure, especially something like Johnson yare to say when ya Johnson yare UTI and now when ya endemo yare STI. UTI urinary tract infection and STI sexually transmitted infection. Na signs and symptoms no SSA. And it is sometimes to be sure of what is going on. No, Dr. Dasha we know. Meaning say America the baby said, do you have any questions? But be a Ghana you be but man call doctor more Ghana. From a 1 year old up of 22 I'm a Ghana. Man call doctor, or family doctor. Man call Dr. Okutu home Dr. Okutu be say, oh any questions be na. What do one our symptoms now? Or diagnose you we treat you. No say okay, coffee. Now a driver no questions asked. You don't even know what you are dealing with. So we have to stop that habit and start asking questions. Asking questions may sound like you are being rude, but you are trying to save yourself. Okay? So the first question I'll be saying, Dr. Mpacho, Eden what is the problem with me? And your friend said diagnosis. What is my diagnosis? What is the problem with me? Mabeka and your man everywhere with their own diagnosis. Doctor, I have migraine. What's okay? Yes, okay, migraine. Doctor, like a migraine, konakoto somatryptan. Na fa no paba ako yimbreba ako. No. Obebi sa questions and sana. Waka say okay, ebe a migraine and I say a migraine. But yes, it's what kind of doctor waka was maybe na what church or whatever they are writing. Oh we are. What's the doctor Mpacho? What is the problem with me? What is my diagnosis? So diagnosis, based on your symptoms. Your symptoms are and your ma or failing. A bit your signs and your symptoms. Okay, signs maybe it is signs by the say edema. A sign you can see the what I say. Oh, how can I say me now every me symptoms because signs there we see it, symptoms we feel it. And there was the signs and symptoms of HIV, signs and symptoms of gonorrhea. Okay, so Bejunsana me bema movie me. It's a symptom because you are feeling it. Yenfa yeni husa obema movie. But do we see say Ujonsono emo I American? Yes, a sign we could see. Or any questions, Biana? What do one our symptoms? Now when you kwan Ese boso mo no bet na o chew ne chiwade enti wo yare na se yare ne ye chew mu ye na ye chew yare ne chiwade ne nyoma wo ya be bo ne de mbo wa ena be bo ma wo yare no ebe ku nkra enku sisi ebe ma wa wanyin kakra yare bi wa no matter what enya dia obesa ebe ka also forever but obeti nya manage ne ye ama we live longer enti doctor na show we o si okay wakoche mmoja usikona kwa labs wakoye labs no dia ba oba ya doctor no show labs na wa show ni ma na wa show withdraw no wakaye say okay kona koto edro we anapa fa ba ko yimbre fa ba ko for 7 days and now one cash watch on watch all people so 7 days o de come at pharmacy ni say anapa fa ba ko we fa ba ko. You don't do that. You never have to do that. Do not go and see any doctor be show a drama wa on church adekuna a drone bayano yarekwa or treaty any how longer as offer a drone na men sorenko. Don't do that. When you do that, you are harming your own self. Ain't no doctor dasha we you know. Meaning say America they baby say do you have any questions? But be a Ghana you be but man call doctor more Ghana. From a 1 year old up to 22, I'm a Ghana. Manko doctor, yene or family doctor. Manko doctor kutu home doctor kutu examine say, oh any questions biana. Or do one or symptoms now or diagnose you we treat you. No say okay, coffee. Now a driver I don't call. No questions asked. You don't even know what you are dealing with. So we have to stop that habit and start asking questions. Asking questions may sound like you are being rude, but you're not. You are trying to save yourself. Okay? So the first question I'll be saying, Dr. Mpacho, Eden what is the problem with me? And your friend said diagnosis. What is my diagnosis? What is the problem with me? Mabeka and your man everyone with their own diagnosis. Doctor, I have migraine. What's okay? Yes, okay, migraine. Doctor, I got a migraine. Konakoto somatriptan. Na fa no pa ba ko yim attend to onipa na de na agent. Inti ye kan me kan de inti a okwa e bisa question say, ebia when was the last time you call toilet? Because we say bibia be sha wo mfe. Eye wo ya, why is bibi sha ha? It could be say when you're in passion. Inti ye bisa say when was the last time I won we know the reason why you saw your last bowel movement because we are impacted that it may push you, it may push everything in your stomach up. It may ya ba besha obo, and we be near ba besha obo. And we ask so many questions that you might think say and yet necessary. Everywhere it may be say when was the last time crown your bear mashai? Men can say and fire home. Depending on the symptoms now we want to assess. So could it be pregnant? Could it be pregnancy or could it be STI? And I will present it. You be about mommy history. You be about papa history. You be about so many things, and we need all those information to build a care plan for one cancer patient. Indeed, you can't be brave. You be about unomonsa ahina how frequent do you drink, and I explain everything. So we know monsa na say. We have to start a protocol for you. And yes, I will be go through withdrawal. I don't know about live here. I just say I'm koda. Internet questions now. Ye tabi sound. And the answer doctor na show waka wasam was show we. What are some of the questions that who patients so as I said will be some doctors and yen Ghana for your doctors no do. Say men disrespect or healthcare providers, but we have this fear for authorities in more power of more providing service for us. They say how, but what we don't know is that they are being paid for the services they are rendering to us, and technically okay, not for them to be disrespected, but I just want you to understand, say, who could depend on no winning dear, ever yarian, who needs an dear.